Imagine stepping off a wooden brigantine onto the cobblestones of Charleston, South Carolina.
Right, and it's the sweltering August heat of 1793.
Exactly. You are a merchant sailor. Maybe you're, I don't know, 19 years old, originally from some small coastal village in Massachusetts.
And you've been at sea for months at this point.
Yeah, hauling molasses, timber, whatever it is. But as your boots hit the dock, your joints are just screaming in agony. A fever is spiking so fast that your vision actually blurs.
Which is terrifying when you're far from home.
Totally terrifying. Within hours, your skin takes on this sickly yellowish hue, and you just collapse in an alleyway right off the waterfront.
And, the reaction from the locals in that exact moment is not to rush to your aid. It's actually the opposite.
Oh, absolutely. The shopkeepers shutter their windows. The local magistrates order the watchmen to keep you away from the residential streets.
Because to them, you are a stranger. You pay zero local taxes, and you're carrying something horrifying.
Right. And as you lie there, miles from anyone who even knows your name, with the local government actively turning its back on you, this completely bizarre sequence of events is set into motion.
A really pivotal sequence of events, honestly.
Yeah, because your suffering, and the suffering of, thousands of young men exactly like you, is about to force a brand new, almost bankrupt federal government in Washington to do something completely radical.
Something that really defies our entire understanding of American history.
It really does.
Yep.
I mean, when you picture the origins of federal health care, or the very first time the U.S. government reached directly into a citizen's paycheck to fund a medical system, you probably envision, well, the mid-20th century.
Right. We tend to project those modern institutional structures backward. The default assumption is usually that large-scale, federally funded health safety nets are inventions of, the New Deal era.
Or like the Great Society programs of the 1960s.
Exactly, complete with massive administrative buildings and complex bureaucracies.
But the true original blueprint for federal medical intervention wasn't drafted by Franklin Delano Roosevelt.
No, not at all.
We have to rewind way past the 1900s, past the Civil War, and drop ourselves right into the fragile, chaotic reality of the 1790s. And that's our mission for today's deep dive. We are going to completely dismantle that timeline.
We're looking at a very specific historical dossier today. It centers on the 1798 Act for the Relief of Sick and Disabled Seamen.
Right. We're going to explore how a tiny 20-cent monthly tax on the wages of sailors built the absolute foundation of the U.S. Public Health Service.
And to really grasp the gravity of this, we need to ask you, the listener, to completely erase the modern American map from your mind.
Yeah, there is no interstate highway system.
There are no transcontinental railroads. I mean, the United States in the 1790s is fundamentally a maritime republic. It's just clinging to the edge of a vast continent.
The entire national project is a massive, precarious gamble, and it depends entirely on one single industry.
Merchant shipping.
Merchant shipping.
Precisely. The federal government had barely established its own authority at this point.
And they were broke, right?
Oh, incredibly broke. They were carrying massive debts from the Revolutionary War, plus there was no federal income tax.
That's a huge point. So where did the money come from?
The overwhelming majority of the money keeping the government solvent came from customs revenue, basically tariffs collected on imported goods at the ports.
Okay, so think of the merchant fleets of the 1790s, the way we think about the physical infrastructure of the modern internet. Or, the entire global supply chain rolled into a fleet of wooden ships.
That's a great analogy.
If a server farm goes down today, the economy panics. In 1790, if those ships stopped moving, the servers literally crashed.
The customs houses would go quiet, the revenue would instantly dry up, and the United States would default on its international loans.
The whole republic would just collapse.
Which means the young men operating those ships were the literal engine of the country. But the mechanics of their labor created this really unique sociological crisis.
Because merchant sailors were incredibly transient.
Extremely transient. The nature of the work required them to leave their home states, sail across the Atlantic or down to the Caribbean, and then inevitably drop anchor in port cities hundreds of miles away from their families.
And this geographical displacement collided violently with how society functioned back then.
Right, because today, if you get in a car crash 3 states away from your house, the local emergency room is legally required to stabilize you.
But in the 1790s,
The concept of a safety net was fiercely, exclusively local.
The prevailing system was rooted in centuries-old poor laws, basically. It was a local charity model.
Exactly. Municipalities, town councils, local almshouses, they collected small local taxes to take care of their own designated residents.
But it was a closed loop.
Entirely. The overseers of the poor in a city like Philadelphia or Charleston had a strict fiduciary duty to their own taxpayers to only spend resources on locals.
So let's go back to our Massachusetts sailor from the intro. The guy bleeding out or burning up with a fever on the docks of Charleston.
The city authorities look at him, they verify he's not on the local tax rolls, and they essentially declare him invisible.
He was entirely outside their jurisdiction of care.
To the local magistrate, using town funds to pay for a doctor to treat a Massachusetts sailor was a misuse of local resources.
Wow.
Yeah, the towns were already strained dealing with their own poor, their own widows, the local sick. They viewed these transient sailors as an invading nuisance, an economic burden that belonged to someone else.
The brutal irony of this is staggering.
How do you mean?
Well, you're telling me the very men who were single-handedly holding the national economy together, the guys generating the federal customs revenue that kept the United States afloat, were stateless ghosts the second they stepped off the gangplank.
Yes. Stateless ghosts captures the legal vacuum perfectly. They were vital assets on a federal spreadsheet, but complete liabilities on a local street corner.
That's incredible.
And we have to consider the physical reality of maritime labor in the 18th century, too. It was devastatingly dangerous.
We aren't just talking about exotic fevers, are we?
No, not at all. We are talking about shattered femurs from falling rigging, crushed hands from shifting cargo, severe hernias, frostbite, scurvy, dysentery. The physical toll was immense.
And the attrition rate must have been terrifying.
It was a brutal life.
So you're doing this backbreaking labor. You know your work is making merchants incredibly wealthy and keeping the government alive. But you also know with absolute certainty that if a boom swings the wrong way and cracks your skull, you will literally be left to rot in an alleyway.
And that's exactly what was happening. This widespread suffering began to transition from a humanitarian tragedy to an urgent macroeconomic crisis.
Right, because if sailors are languishing incapacitated in port cities or dying at alarming rates without medical intervention, you face an immediate labor shortage.
Precisely. A captain cannot sail a merchant vessel without a healthy crew.
If the ships sit idle in the harbor, the cargo rots.
If the cargo rots, the merchants go bankrupt.
And if the trade stops, the federal government runs out of money. It's a massive domino effect.
And the federal government, which at this point in history was incredibly reluctant to do anything that even looked like interfering in local affairs, is staring at this problem.
Because state lines are being crossed, national commerce is being threatened, and local municipalities are just throwing their hands up.
It forced a massive philosophical pivot. The national government realized that because the states and towns categorically refused to absorb the cost of caring for these transient workers, the health of the merchant sailor was, by default, a federal problem.
But the suffering on the docks wasn't just an economic math problem.
No, it wasn't.
This is where the narrative shifts from a labor dispute into something much darker. The catalyst that actually forced the Fifth Congress to take unprecedented action wasn't just compassion for broken bones.
It was sheer visceral terror.
Yeah. The 1790s were marked by something that modern Americans have only recently gained a true appreciation for.
The sudden, devastating arrival of epidemic disease.
Right. This decade was punctuated by terrifying outbreaks of yellow fever striking the major coastal hubs.
Philadelphia in 1793 actually lost roughly 10% of its entire population in a matter of months.
10%? That's mind-boggling.
It was catastrophic. And New York, Boston, Baltimore, they all faced horrific summer outbreaks too.
Let's really paint a picture of a yellow fever panic for you, the listener, because it's hard to overstate the psychological trauma this inflicted on a city.
They didn't know what caused it. Germ theory didn't exist yet. They didn't know a specific mosquito was transmitting the virus.
They just saw people suddenly bleeding from their eyes, vomiting black bile, turning intensely jaundiced, and dying in agony within days.
The confusion and fear completely dictated the social response. I mean, the federal government literally fled Philadelphia during the 1793 outbreak.
Wait, really? The whole government?
Yes. George Washington and his cabinet abandoned the capital. Wealthy merchants packed up their carriages and escaped to the countryside.
I imagine those who couldn't afford to leave were just trapped.
Trapped in a city where the death carts rolled through the streets day and night.
But even without understanding the biology of a virus, humans are incredible pattern recognition machines.
They are. And the people living in these port cities started noticing a very specific correlation.
They observed the timeline.
Exactly. A ship arrives from the West Indies or the Caribbean, it drops anchor, the crew comes ashore to the taverns and boarding houses near the waterfront, and within a week or two, the surrounding blocks erupt in fever.
So does this mean the motivation to help sailors wasn't entirely driven by compassion, but actually by fear?
Yes, absolutely. The perception of the sailor flipped almost overnight. He was no longer just an economic asset who might need pity for a broken leg. He was suddenly viewed as an active biological weapon.
The waterfront transformed from a bustling hub of commerce into the front line of an invasion.
The sailor became the vector, and this realization forged a conceptual link that is the absolute bedrock of our story.
Which is
The local populations and the federal government realized that caring for the seamen and guarding the ports were not two separate issues. They were entirely inseparable. Two sides of the exact same coin.
you cannot protect the city from the disease without managing the health of the incoming traveler.
Exactly.
It's like an early, highly localized version of modern pandemic border control.
That's a great way to think about it.
They started looking at the port as this porous membrane. If the membrane is breached by a sick sailor, the city burns with fever, the quarantine flags go up, and the local economy halts entirely.
And the urgency of that situation completely stripped away the philosophical debates about states' rights versus federal power.
Leaving a sick sailor in the street was no longer just a cruel reality of the local charity model. It was a biological threat to the entire republic.
The municipal governments didn't have the medical infrastructure to quarantine and treat hundreds of incoming sailors, and the local charities were bankrupt. The breaking point had been reached.
Which sets the stage for a monumental piece of legislation. We are in the summer of 1798,
The country is desperate to keep the trade routes open.
and equally desperate to keep the yellow fever out. So on July 16, 1798, President John Adams signs an act for the relief of sick and disabled seamen.
This is it. This is the first federal health law in the history of the United States.
And the creation of the first federally run medical care apparatus.
It is a phenomenal piece of pragmatism. The Fifth Congress didn't have the budget to simply appropriate massive funds to build state-of-the-art hospitals.
Right, because as we established, they're basically broke.
So they had to invent a self-sustaining funding mechanism out of thin air.
And the mechanism they chose was brilliantly radical.
They instituted a compulsory deduction.
A tax.
A tax. The law mandated that 20 cents per month be withheld from the wages of every single merchant seaman on an American vessel.
It wasn't voluntary then.
Not at all. It wasn't a suggested donation. It was a federal tax levied directly on the labor of the individual sailor.
But wait, let's look at the mechanics of this. Because enforcing a federal wage tax in 1798 sounds like an administrative nightmare.
It definitely had its challenges.
I mean, we don't have the IRS. We don't have digital payroll software or social security numbers. How did a barely functioning government enforce a 20-cent deduction on rugged, independent ship captains who spent most of their time out on the open ocean?
They turned the shipmasters into deputized tax collectors.
That is wild.
The law required the captain of the vessel to keep a meticulous ledger. Before he paid out the wages to his crew at the end of a voyage, he was legally obligated to skim that 20 cents per month per man right off the top.
I can only imagine the friction that caused on the deck of a ship.
Oh, surely.
You've got a crew that has just survived hurricanes and scurvy, waiting for their payout, and the captain has to explain that the federal government is taking a cut. Wait, how much was 20 cents relative to their pay back then?
20 cents might not sound like much to us, but in the 1790s, a sailor's monthly wage might have been anywhere from $8 to $14.
So that 20 cents was a tangible piece of their livelihood.
It absolutely was.
How did they make sure the captains actually did it, though?
The compliance mechanism was the stroke of genius. The federal government didn't send agents out onto the high seas to audit the captains. They waited at the choke point.
They waited at the custom house, the membrane.
Exactly. When a merchant ship returned to an American port, the captain could not legally unload his cargo until he cleared customs.
Ah, so they had leverage.
Total leverage. The federal customs agent would board the ship, review the manifest to calculate the tariffs on the cargo, and then ask for the crew ledger. The captain had to hand over the collected 20-cent hospital taxes right then and there.
And if he refused, or if his math was just wrong?
If he refused, the ship wasn't cleared. The cargo sat. The captain wouldn't get paid by the merchants.
That is ruthless and brilliant. They attached the healthcare tax to the very economic engine that the tax was designed to protect.
They really did.
But here is the organizational twist that really boggles the modern mind. We are talking about building medical facilities, hiring doctors, caring for the sick, but the entire apparatus was handed over to the Treasury Department.
Which seems very strange today.
Yeah, why on earth would the department responsible for finance and taxes be running a hospital system?
It seems entirely counterintuitive until you look at the federal footprint in 1798.
Because there was no Department of Health and Human Services.
There was no Surgeon General. In fact, outside of the post office and the small military, the federal government barely existed in a physical sense.
Right, there were no sprawling federal buildings in every city.
Except for the custom houses. Alexander Hamilton had built the Treasury Department to be the revenue engine of the country. To do that, he had to place customs collectors in every major port.
Backed up by those revenue cutters, right?
Yes, heavily armed revenue cutters. Small ships that patrolled the harbors to prevent smuggling. The Treasury Department was the only federal bureaucracy that actually had personnel standing on the waterfront in Boston, New York, Baltimore, and Charleston.
So it was purely an administrative convenience.
Completely.
The customs guy is already standing on the dock collecting money from the captain. You just hand him an extra ledger and tell him, "Congratulations, you are now also the hospital administrator."
That's essentially what happened. The customs collectors took these 20-cent contributions and pooled them into what became known as the Marine Hospital Fund.
And it was these local treasury officials who were then tasked with turning that money into medical care.
Exactly right.
Which brings up another mechanical question. We call them marine hospitals, but they weren't instantly erecting massive brick pavilions on the waterfront, were they? What did this 20-cent money actually buy in the early years?
In the immediate aftermath of the 1798 Act, the care was incredibly rudimentary and improvisational.
So no big brick buildings yet.
No. The customs collector in a given port would look at the funds he had accumulated. If it was a small amount, he might just rent a few rooms in a waterfront boarding house and contract a local private physician to visit the sick sailors.
So the first federal hospitals were basically just rented bedrooms above taverns with a doctor on retainer.
Yes. They were purchasing basic survival, a clean bed, poultices, perhaps an amputation if a limb was crushed, and basic quarantine for fever cases.
The goal was simply to get these men out of the alleys and off the local charity rolls.
Precisely. But over time, as the 20-cent taxes accumulated, the Treasury Department began to purchase land and construct dedicated physical hospital buildings specifically for these men.
This structure, a payroll-funded compulsory deduction that pools money into a central fund to prepay for medical care, has led to a fascinating modern debate.
It certainly has.
When you look at the mechanics, it is incredibly tempting to look at the 1798 law and declared America's first national health insurance scheme.
It is a very common framing in historical discussions.
Does it hold up?
If we use the term health insurance as a purely mechanical analogy, it holds up. It was a prepaid medical benefit. You pay into the fund while you are healthy and working, so the care is guaranteed when you inevitably fall from the rigging or catch a fever.
But there is a massive ideological trap here, isn't there?
Oh, a huge one.
Because we hear payroll-funded medical benefit, and our 21st century brains immediately jump to modern debates about universal health care, Medicare for all, and the philosophical role of government in providing social welfare.
And that is the danger of telescoping history. We cannot project modern progressive social welfare philosophies onto a desperate 18th century government.
So when the Fifth Congress passed this act, they were absolutely not trying to lay the groundwork for universal health entitlement for the American citizen?
Not at all. It wasn't about the intrinsic right to wellness.
Okay, so what was it?
It was a targeted, mechanical fix to a specific economic and biological vulnerability. The founders weren't sitting in taverns debating the moral merits of socialized medicine.
They were looking at empty ships in terrified cities.
Exactly. And they realized that if they didn't patch up this specific class of transient workers, the country would go bankrupt, and yellow fever would decimate the coast.
Let's translate this into a modern scenario for you to really clarify the mindset. We want to be very careful to impartially report on what the Fifth Congress was actually doing, not take sides on modern healthcare debates.
Right, we're just conveying the ideas contained in the original source material.
So imagine if Congress today decided to pass a universal healthcare tax, but the law stated it strictly applied only to long-haul truck drivers who cross state lines.
That's a very apt analogy.
And the explicit reasoning from Congress was, these truckers never stay in one zip code long enough to qualify for state-funded Medicaid, and if the truckers stop driving, the grocery stores in every city go empty in 3 days.
That analogy perfectly isolates the intent. Congress wouldn't be doing it to establish a new era of universal human rights. They would be doing it to prevent the supply chain from collapsing.
The 1798 Act was a massive federal intervention, but its roots were pragmatic survival, not utopian social engineering.
Exactly. But regardless of their narrow intent, the practical reality of what they built couldn't be contained.
Right, because you start collecting money, you start hiring doctors, you start renting buildings. Bureaucracies have a tendency to grow.
They do indeed.
The footprint of this medical system expanded in ways John Adams probably never envisioned when he signed the paper.
The expansion was tied directly to the physical expansion of the nation itself. Initially, the Marine Hospital Fund was focused entirely on the established deep-water East Coast ports.
Like Boston, Norfolk, Charleston, Philadelphia.
Yes. These were the hubs of the transatlantic and Caribbean trade.
But the economy of the United States didn't stay pinned to the Atlantic Ocean.
No. As the 19th century progressed, the country pushed aggressively westward.
And as commerce moved, the medical safety net was forced to follow.
We see the rise of inland waterways as massive economic arteries. The Ohio River, the Mississippi River, the Great Lakes.
Suddenly, you have a massive new workforce of inland sailors.
Men working the flatboats, the keelboats, and eventually the steamboats.
The steamboats changed everything. They were moving massive amounts of agricultural wealth down to New Orleans.
But those rivers were dangerous. You have boiler explosions, malaria, cholera out on the frontier.
The risks were just as severe, and the transient nature of the work was identical to the ocean sailors.
Exactly. A deckhand from Ohio gets horribly burned in a boiler explosion near Memphis. The city of Memphis has no desire to pay for his care.
So the Treasury Department had to expand the system again.
They did. The map of the Marine Hospital Service began to trace the economic arteries of the nation.
It's an incredible visual. Just imagine a map of the United States slowly lighting up with federal medical outposts, trailing right behind the merchants and the explorers.
It really maps the economic growth of the country.
But as the system expanded, it wasn't just merchant sailors in the beds. The logistics of running these scattered hospitals created some strange bedfellows.
One of the most fascinating immediate expansions happened just a year after the original act.
In 1799.
Right. Congress passed an amendment that folded the officers and sailors of the United States Navy into the Marine Hospital system.
Wait, really? The military is using civilian Treasury-run hospitals. Organizationally, that sounds like a mess.
It was a necessity born of scale. In 1799, the U.S. Navy was tiny. They were fighting the quasi-war with France, but they did not have the budget or the infrastructure to build a massive, independent network of military hospitals.
Meanwhile, the Treasury Department is already building wards in the major ports.
Precisely.
So they essentially said, we have a bed here in Boston. Why build 2 hospitals when the customs collector can just charge the Navy for the bed space?
That was exactly the logic. The Navy sailors were subjected to a similar wage deduction, and they utilized the Marine hospitals for nearly 2 decades.
Did they eventually leave the system?
Yes, it wasn't until after 1818 that the Navy grew large enough to begin demanding and constructing its own dedicated, separate medical facilities.
But for that early period, the waterfront wards were a shared, pragmatic solution for anyone keeping the maritime borders secure.
Correct.
But let's look at the structure of this growing system. By the mid-19th century, you have dozens of these hospitals scattered from Boston down to New Orleans and up the Mississippi River.
It was a huge network.
But they aren't functioning like a modern cohesive agency, are they?
No, and this is where the system nearly collapsed under its own weight.
What happened?
For the first 70 years of its existence, the Marine Hospital Fund was incredibly decentralized. It was just a loose collection of individual pots of money managed by local customs collectors.
Which means the quality of care depended entirely on how competent or corrupt the local customs guy was.
Precisely. In some ports, the hospitals were well run. In others, the funds were mismanaged, the buildings were dilapidated, and the political patronage system meant that local doctors were hired based on who they voted for.
Rather than their actual medical skill.
Exactly. The system was chaotic, disjointed, and deeply inefficient.
The acorn was rotting a bit on the ground, so to speak.
It required a massive shock to the system to force a reorganization.
And what was that shock?
It came in the aftermath of the Civil War. The war had demonstrated the immense power of centralized military-style medical logistics.
So between 1870 and 1871, the federal government looked at this sprawling, chaotic mess of Treasury hospitals and fundamentally rebuilt it.
They did.
This is the pivot point where the modern public health apparatus actually takes shape. How did they restructure it?
They centralized authority. They stripped the day-to-day control away from the local customs collectors and created a formal marine hospital service.
And who was in charge?
At the head of this service, they installed a supervising surgeon general based in Washington, D.C., to oversee the entire national network.
They brought top-down accountability to the 20-cent fund.
They also instituted rigorous medical examinations for the doctors. You could no longer get a job just because you were friends with the local politician. You had to pass a standardized medical board.
That's a huge step toward professionalization.
It was. And in 1889, they took it a step further and created the Commissioned Corps.
The Commissioned Corps.
Yeah.
This is the uniformed, mobile cadre of health officers that we still see today, responding to hurricanes and pandemics.
Yes. They adopted military ranks, military discipline, and a mobile structure.
How did that change things on the ground?
Well, if yellow fever broke out in New Orleans, the Surgeon General could now order a uniformed doctor from Boston to deploy to Louisiana immediately.
The doctors no longer worked for the local port. They worked for the national service.
Yeah, actually.
So we have to be very careful with our timelines here. When we see the U.S. Public Health Service today, with its Surgeon General and its uniformed officers, we can't assume that existed in 1798.
No, 1798 was purely the administrative seat. It was the funding mechanism.
The centralized uniformed agency doesn't emerge until the 1870s.
Right. And by 1912, recognizing that the scope of their work had expanded far beyond just treating sailors, Congress officially renamed it the United States Public Health Service.
But the DNA of 1798, that core philosophy, never vanished. It scaled up.
It really did.
They think about what this centralized marine hospital service was asked to do in the late 19th and early 20th centuries. The United States begins experiencing massive waves of immigration, millions of people arriving on steamships from Europe and Asia.
And who does the federal government put at the gates?
They put the doctors of the Marine Hospital Service.
The very same service that was created to check sailors for yellow fever in the 1790s is now deployed to Ellis Island in New York and Angel Island in San Francisco.
The scale is infinitely larger, but the mission is identical.
The port is still the porous membrane. The incoming traveler is still the potential vector.
The doctors at Ellis Island, using button hooks to check the eyes of immigrants for trachoma, listening to their lungs for tuberculosis, that is the direct institutional descendant of the customs collector trying to keep the 1793 yellow fever out of Philadelphia.
The dual mission never changed. Heal the worker, guard the port.
It's incredible to see the through line.
And as the science of medicine advanced, the service evolved too. The Marine Hospital Service established the hygienic laboratory in 1887 to study bacteria,
Which eventually grew into the National Institutes of Health, the premier medical research agency in the world.
Yes, exactly.
It is genuinely staggering to trace the trajectory of this for you. You start with a desperate 20-cent deduction logged by candlelight in a ship captain's ledger because a Massachusetts boy collapsed in Charleston.
And through a series of pragmatic, survival-driven adjustments, that tiny fund builds the waterfront wards,
Which scale into the Marine Hospital Service,
which mans the gates at Ellis Island and pioneers bacteriological research.
which eventually becomes the massive global public health apparatus we rely on today.
It is a profound lesson in the unintended consequences of institutional design.
The founders didn't set out to build a global health agency. They were simply trying to solve an immediate, terrifying crisis.
They needed the ships to sail, and they needed the cities to survive the summer fevers.
But the mechanism they created to solve that tiny problem possessed the architectural capacity to absorb the massive health crises of the next 2 centuries.
It's really remarkable.
We have covered an immense amount of historical ground today on this deep dive.
I really have.
We started with a broke, terrified republic in the 1790s, a nation completely dependent on the sea for its economic breath. We watched them grapple with the brutal vulnerability of their maritime workforce and the paralyzing threat of imported epidemics.
We saw the friction as local towns turned their backs on the men who carried the nation's trade.
And we watched a reluctant federal government enact a radical, unprecedented wage tax to fix the engine of their economy.
And trace how that pragmatic, Treasury-run hospital fund expanded westward, centralized its authority, and quietly laid the bricks for the United States Public Health Service.
The waterfront was the crucible. It was the front line of commerce. And out of pure necessity, it became the front line of public health.
That's really the core of it all.
It fundamentally changes how you look at the origins of our safety net. And it leaves a final lingering thought to mull over, something to take away from this deep dive.
What's that?
We look at the sprawling federal health agencies of today, and we often debate them in terms of morality, universal wellness, and the ideals of a modern society.
Right.
But if the very bedrock of American federal healthcare wasn't built on benevolence, if it was born entirely out of an urgent, calculated need to protect commercial supply chains and defend our borders from external biological threats, how much of that original 1798 survival instinct is still quietly dictating who and what our health systems actually value today?